Hi everyone, how are all of you? Good afternoon. It's good to be here again, and we are going to be addressing yet another interesting topic. Today on Doctors Go Live on Columbia Asia Facebook, we will be talking about cardiovascular disease and its treatment options, because as we all should know, cardiovascular disease is the #1 killer in Malaysia and also in the world. So if that's not frightening enough, but thankfully, medical sciences have made treatments possible and available. Okay, so let's take a look at the various options that we have, as well as updates on the latest ways to treat heart diseases. Okay, today we are talking to consultant cardiologist, Dr. excuse me, Dr. Dhanan Umadevan of Columbia Asia Hospital Iskandar Puteri. Hello, doctor. How are you?
Hello. Hi. Yeah, I'm fine.
Thank you so much for making time to be here with us.
Yeah, sure. No problem.
Okay, let's go straight into the questions. First of all, maybe you can explain a little bit about how heart diseases actually happen. How do they develop?
Well, actually, heart disease is not something that happens overnight. It takes time to happen. And the process by which it happens is known as atherosclerosis. So this is a process in which there is a gradual buildup of plaque. Plaque meaning deposition of fat, inflammation in the lining of the blood vessel that supplies the heart. And this process usually starts from the third decade of a person's life. That means from the early 20s, in fact. And it gradually builds up. And over time, as the plaque volume increases, the patient will start to have symptoms.
And that is because of eating habits.
Well, we are in Malaysia, so there's a lot of good food. Yes. Unfortunately, we as Malaysians tend to eat a lot. And sometimes we don't really look into detail what we are eating. And of course, eating habits are a major contributor to the development of atherosclerosis. Of course, there are other things like exercise and etc.
Yeah, of course. So you're saying that this starts from the 20s?
Yeah, early 20s. In fact, heart disease is not something that, that only affects the elderly. Nowadays, we are seeing more and more younger patients who come in with acute heart attack. Yeah.
Yeah, it's very alarming, actually.
Yes, it is.
Yeah. Okay, well, sorry, carry on, you were saying?
Yeah, so basically, in an acute myocardial infarction, about 1/4 of patients with who suffer a heart attack will actually pass away. And out of this number, half of them will die within the first hour. And of all these patients, 50% of these patients, it will be the first, last, and only symptom. So therefore, early diagnosis and treatment of an acute myocardial infarction or acute heart attack is very important to prevent that. Yeah. So we can proceed to the next slide.
It's also possible, doctor, for someone to have heart attack twice.
Yes, it is. In fact, if someone had a first heart attack and maybe the underlying cause was not properly treated, for instance, maybe the patient was just treated with medications only, the patient is still has a chance to develop a second heart attack or subsequent heart attack.
I see. So there's such a thing as a minor heart attack, and then you survive it, and then you could have another one after that.
Yes, there is.
Okay, since we're on that topic, let's take a look at risk factors for heart diseases.
Well, basically, the risk factors for heart diseases can be divided in two large groups. The first group being the non-modifiable group of risk factors. This would include a person's age, so all of us get older, we don't get younger. The gender, so we don't get to choose what gender we are. And family history. So for instance, if we have a male first-degree relative who had heart disease before the age of 55, or any female first-degree relatives who had a heart disease or heart attack before the age of 65. So this will be known as the non-modifiable risk factors. Okay. And the
doctor, can you explain what is a first-degree relative?
Well, first-degree relative would mean for instance, your parents, your siblings. These are your first-degree relatives. Yeah.
Okay. All right. Okay.
The second group is the modifiable group of risk factors. This is something which we have control of.
Okay.
Like for instance, diabetes, whether we end up having diabetes, whether we have high cholesterol or high blood pressure, whether we smoke or not, how well we manage our stress, and how well we manage our weight, because obesity is also an emerging pandemic in Malaysia.
Yeah. Okay. Okay, what are the signs and symptoms of heart disease? I think a lot of people would like to know this because they are fully aware that heart attacks, of course, it can be fatal. So perhaps they would like to know what they need to look out for in case they can get to the hospital in time, and then it can be life-saving. So this is very important for all of us to know.
Yeah, sure. So when you talk about the symptoms of a heart attack, we have the typical symptoms. Yeah. So some patients would the majority of patients would experience a sort of a crushing sort of chest pain. This is illustrated by this picture here. You see, like there is a belt over the person's chest, so the person may feel a pressing or compressing sort of or heaviness over the chest. And the pain is usually in the center of the chest or maybe on the left-hand side. And this pain may sometimes radiate to the left shoulder or the left arm or even the left side of the neck or even all the way up to the jaw. Other than that, the patients may have the feeling of nausea. That means they may feel like, like vomiting. They may have profuse sweating, cold sweats. They may have difficulty in breathing. Yeah. So all of these are the initial group of what we call as the typical symptoms. But however, having said that, not everyone has the typical symptoms. For instance, women in particular may just present with simple epigastric pain or back pain. So they do not present with the typical crushing chest pain which males normally have. So it's very important not to just dismiss epigastric pain as just maybe acid reflux or gastritis. It could be a heart attack. Yeah. The other group of patients where we tend to miss the symptoms are those with diabetes. So diabetic patients have a lot of nerve damage, so they don't have chest pain. Instead, the only symptoms that they have may be just difficulty in breathing.
I see. Okay, doctor, sorry, I was going to ask you about all these signs and symptoms. Do they actually happen at the same time? Meaning, like, how far ahead do you get these things before having an idea of when the heart attack is going to happen? For example, if you have this tightening of the chest, I'm just assuming that that's already a very last minute symptom. So like it's going to happen anytime now. But if you have nausea, sweating, all this left arm pain and jaw pain and whatnot, how long before the attack will actually happen? Is this something that doctors can gauge?
Well, okay. Usually, the symptoms which I just mentioned in this slide are the symptoms of a full-blown heart attack. So some patients may have symptoms before that. That means they may have just vague chest pain that comes on and off, comes on with exertion or whenever they exercise, or for instance, whenever they walk up the stairs, and then goes off whenever they rest. So if the patient does not heed these early signs or symptoms and doesn't do any, say for instance, any investigations, they may end up with a full-blown heart attack whereby they present with all these symptoms. Yeah? So sometimes you may have, these early symptoms which need to be looked into.
But days before or weeks before?
Well, sometimes it could be days before, yeah. But however, if you remember in my earlier slides, about 12.5%, that means of patients would actually have chest pain for the first time. That will be their only first symptom, and they had no warning beforehand. So about 12.5% of patients, that would be the first and only symptom of a heart attack. So unfortunately for that group of patients, they don't have any early warning signs.
Okay. So that would be the last thing that happens in a full-blown heart attack, the tightening of the chest. Okay.
Yes, correct. Yeah.
Okay. Do we have any more slides? Okay, all right. What exactly happens to a heart attack?
Well, okay. If here I'll give an analogy of like a pipe, your blood vessel in your heart, right? It's like a pipe. So when you have, all of us have actually 3 main blood vessels, and the size may vary between 2.5 to 4 millimeters in diameter. And like I mentioned, the process of atherosclerosis would have started way before, maybe in the early 20s. So the area of the wall which is diseased is not normal, yeah, and that means that the wall lining the plaque is actually very vulnerable. It can rupture anytime. So the blood which normally flows within the blood vessel is usually not exposed to the contents of the plaque. So when you have a heart attack, what happens is that the overlying layer of the plaque actually ruptures, and the blood which is normally inside the lumen of the blood vessel is exposed to all this lipid-rich content of the atherosclerotic plaque. So if, for instance, if you have a cut over your hand, your body tries to heal itself by forming a blood clot. Anywhere else in the body, this may be beneficial, but in the heart, it's the total opposite, because when you form a blood clot, it actually occludes the blood flow, and therefore then the heart muscle starts to starve of oxygen and nutrients. So that's what happens during a heart attack.
Right. So next question is the importance. Okay, this is very important. Very important question about importance of quick treatment when you suspect signs of heart diseases, because as we know, the clock is ticking and there's no time to waste. So why this urgency?
Well, in the field of cardiology, we have a saying: "Time is muscle." Yeah. Yeah. So the earlier the patient presents to tertiary care center and gets the best treatment, the better the outcome. So it's very important to remember, not all private hospitals actually practice primary angioplasty. Primary angioplasty means a service whereby we do an angiogram and open up the occluded vessel any time of the day, whether it's 24/7, whether it's 2 o'clock in the morning, 3 o'clock in the morning. And this is very important because unfortunately, most of the heart attacks occur early in the early morning, between 2 o'clock, 3 o'clock, 5 o'clock. Most heart attacks occur in the early morning. And this there's a reason. Well, it's got to do with our circadian rhythm. So in our body always has a circadian rhythm whereby, usually during the day, your blood pressure tends to be higher. And when you rest at night, usually the pressure tends to be on the lower side. But in patients who have diabetes, high blood pressure, and etc., that circadian rhythm is not so normal. So they may actually have a spike of blood pressure when they are sleeping, and and this may then lead to an acute heart attack in the early morning hours. So that's why it's very important to go directly to a hospital which provides this 24/7 primary angioplasty services. Here in Columbia, Asia, Iskandar Puteri, we have been doing so since July 2018. Yeah? And if you seek treatment early, the outcome is good. Good meaning you can continue leading a normal or near to normal life as possible. Whereas if you come in late, you may have some permanent damage to your heart muscle. And heart muscle is not something which you can replace. Whatever is lost is something permanent. So the damage is permanent. It's not reversible. So therefore, it's very important to come to a center which provides these services 24/7. And another important indicator of quality is what we know as what we call as the door to balloon time. This is the people have done studies and they've come up with an international standard. That means if you have a door meaning the time at which the patient comes or passes through the emergency department, and balloon time is the time at which the occluded vessel is open. Yeah. So the international standard is less than 90 minutes. So in Columbia, Asia, Iskandar Puteri, our average or mean time is about less than 60 minutes. So this is very important because again, it translates to better cardiac outcomes. Yeah.
Okay, that's good to know. Perhaps you can also share some tips on how to prevent heart diseases. Yeah. Is there anything that we can address, maybe lifestyles?
Yes, a lot of it has to do with our lifestyle. So if you remember the earlier group of modifiable risk factors, these are the things which we can tackle. For instance, diabetes. if we should try to prevent from ourselves from having diabetes in the first place. We should lead a very active life. We should exercise. We should not give excuses and say that we have no time to exercise. We should always make time for exercise, at least half an hour a day. Nowadays, in our very busy and hectic sort of lifestyle, we tend to be very sedentary. Most of the time when we go to office, we are sitting down, we are in front of the computer, we don't do much. All this is not good. So we need to get out and really exercise at least half an hour a day. Exercise is very important. If we do have diabetes,
sorry, I don't mean to interrupt you, but talking about exercise, sometimes we hear this term cardio. So there's what do you call it? There is strengthening, muscle exercise, and there's also cardio. So people say, okay, when you do like cardio 3 times a week, 4 times a week, what do you think? How often should cardio exercises be done by a person?
Yeah, okay. So if you're talking about exercise on a whole, there's 2 main groups. One is cardio-related or cardio exercise. That means these are exercises which, or aerobic exercises. These are exercises which actually increase your heart rate, and the examples will be like cycling, jogging, running. So aerobic or cardio-related exercises are the ones which are beneficial to heart health. On the other hand, exercise such as weight-bearing exercises may not confer the same level of benefit. It may make you look outwardly very healthy, but inwardly, it may be the other way around. So the most important is to get enough aerobic exercise. Even simple thing like walking. You can walk in your housing estate, but if you're doing something which is not say a low threshold exercise, such as walking, then probably you need to do it for a longer duration, maybe 1 hour. But if you're doing something like jogging or cycling, maybe half an hour, So, so therefore, if you're asking me about exercise, of course, aerobic exercise is the most important. The other thing is that if we have, for instance, diabetes, or we have family history of diabetes, we should go and get checked and make sure that our diabetes is well controlled. What is sad nowadays is that a lot of patients just buy medicine over the counter from, for instance, the pharmacy, and don't see their doctors, and they have no idea whether the diabetes is well controlled or not. They would have been taking medications for many years and then just suddenly present with a heart attack. So it's very important to go and see your doctor. Make sure the diabetes is within control. Make sure your blood pressure is within good control if you have high blood pressure. If you have high cholesterol, again, take measures to look after it. So, for instance, you may need to look after your diet, see a dietitian, do exercise, because exercise also can lower your cholesterol levels. And then if you really need to, yes, you need to take cholesterol medications. Yeah. So those are the steps to prevent heart disease. Yeah.
Yeah, so that's why also health screenings are very important, so that we can actually get to know early about what's happening in our body, and perhaps we can also go to Colombian Asia Hospital Iskandar Puteri to see Dr. Dhanan and get your heart checked. Okay, doctor, thank you for sharing that with us. Now we've come to our last question about detection. When a patient comes with a complaint, how do you determine what is wrong with the patient? How do you diagnose a heart disease?
Okay, so the first and simplest test would be the ECG. Yeah. So ECG stands for electrocardiogram. So this is basically a recording of the electrical activity in your heart. From this, the cardiologist will be able to tell whether you have, for instance, whether you have suffered a heart attack previously, whether your heart rhythm is normal, whether your heart rate is normal. This is the first and foremost test. The second test that the cardiologist may send you to do would be the stress test, exercise stress test. So in this test, you basically walk or run on a treadmill, but you're attached to the ECG stress test machine. And the doctor would then compare the ECG before running, during running, and after running, and then make a conclusion as to whether you do indeed have heart disease or not. The other thing is, for some patients who come with shortness of breath, then an echocardiogram may be done. So an echocardiogram is basically a scan. It's a non-invasive test. We just put ultrasound. We use ultrasound, And this scan would determine what is the heart's function, whether the valves are all normal, whether the wall thickness is normal, whether the heart chamber is normal. So that's the third test. Of course, nowadays with better technology, we have more precise tests, like for instance, the CT coronary angiogram. This is again a non-invasive test whereby the patient goes through the CT scanner, and it's specific for the heart. And we can actually look at all the three main vessels in the heart and determine whether there is indeed any narrowing within the heart. If, for instance, any of the above tests were abnormal, then you may be subjected to a coronary angiogram. So a coronary angiogram is basically a test whereby a small catheter is threaded through the blood vessel in your hand or leg. And this catheter will go all the way to the heart. And then the doctor will be able to take a picture of the three main blood vessels in the heart. And after the angiogram is done, we can determine where the block is, how severe the block is. And if it is severe enough, the blood vessel can be opened. Open meaning we would then do angioplasty. So angioplasty would involve ballooning. That means we will do balloon angioplasty first. And this is then followed by stent implantation. Stent is like a metal spring, which is implanted into the blood vessel to maintain and scaffold the blood vessel in an open state. Yeah. And the stent is actually coated with medications. So most of the stents nowadays are all medicated stents. And the purpose of the medication is actually to prevent re-narrowing within the stented area. Yeah.
I see.
Yes.
So it actually helps the blood vessels to dilate.
Well, we have to dilate the narrowed area first with the balloon, and then that is followed by the stenting. Stenting is basically to maintain it in an open condition, because your blood vessels are elastic. So if you just balloon it alone, there's always a chance of recoil.
Right. So you actually leave the stent inside?
Yes, the stent is left inside. Yeah, and it's a totally inert material, so you don't have to worry about the stent having any side effects. And the stent does not move. Once it's implanted, you can still go and have an MRI. For instance, if you have a fracture or you need a scan anywhere else, you can still proceed with all of that. There's no issue with that.
Right. Yeah. Doctor, how do you determine which test to carry out on which patient? Because there seems to me like there are 4 or 5 different ways for you to diagnose.
Yeah, so of course, it would depend, number one, whether the patient is having symptoms at the point of presentation. That means if when they first come to the clinic, if they are having ongoing chest pain, then of course it could mean that they are having something very serious. So of course, immediately they do ECG and echocardiogram. And if the ECG shows something serious, for instance, from the ECG, if I know that they had a previous attack or it's not normal, then they may be subjected straight to a coronary angiogram. On the other hand, if the resting ECG is normal, then they would proceed with a stress test first. And if the stress test is abnormal, then only they will do further tests.
I see. Okay, thank you so much for all that. Let's address some questions from our audience. Okay, the first question is from Miss Karen Lim. Her question is, if I am on medication to treat heart disease, does that mean I am no longer at risk of a heart attack? That's a good question. What do you think, doctor?
Yeah, it's a good question. Basically, if you're on medications, your risk of having a recurrent or second heart attack is very much lower if you do not, compared to a person who is not taking medication. So it doesn't mean that there is no risk, but the risk is very much lower. So it's important that you continue with your medications.
Okay, thank you. We hope that Ms. Karen Lim is satisfied with that answer. There is also some questions from Mr. Barjesh Paul. He's a loyal viewer for Doctors Go Live here. Okay, doctor. His question is, I like dry fruits like cashew nuts, walnuts, almonds. Do these have bad effects on the heart?
Nuts in general do not have a bad effect on your heart. In fact, it may be beneficial. But I mean, in general, the main rule is everything in moderation. So don't go overboard on one particular type of food, but it's have a well-balanced diet, and I think that is the most important. Nowadays, we tend to eat a lot of outside food, and if you really look at the food, it's not really a well-balanced diet.
Yeah. Okay. There's also a follow-up question from Mr. Barjish also. Is there any chance or risk of reblocking of stents?
Yes, there is. Of course, like any treatment modality, there's no such thing as a 100% guarantee. If, for instance, if you do a bypass surgery, for instance, not all the bypass grafts may last forever. For instance, they may last for only 10 years. So the same thing goes for stents. Again, if the patient doesn't look after their risk factors, for instance, some patients come with a heart attack, then they get stented, they feel better, and they continue on with their bad habits, then that's not good. So they really have to look into all the risk factors, manage it well, take their medications well. Then the risk of reblocking or re-narrowing within the stents is very, very much lower. So there are some patients which we have checked the blood vessel 10 years after angiogram and it's still normal. However, there are also another group of patients who don't really look after the risk factors. Then this group of patients may have a chance of reblocking or re-narrowing within the stents, or maybe in a new area of the blood vessel.
So when that happens, you've got to remove that stent and replace it?
No, usually in general, once the stent is in place, we do not remove it, but we would actually try to cut out the tissue within the stent. So, when you have a re-narrowing within the stent, usually is due to an overgrowth of tissue within the stented area. So we have a special balloon which we call as a cutting balloon. So that is to cut the atherosclerotic plaque within the stent. And then usually the doctor would just use a medicated balloon, what we know as a drug-eluting balloon. So this drug-eluting balloon is then used within the stented area. So it's a balloon coated with medication, and that medication will then be applied to the lining of the blood vessel within the stented area. And the purpose of the medication is actually to prevent recurrence of re-narrowing within the stented area.
Right, I see.
Yeah.
Okay, Dr. Barjish Paul, Barjish Paul says, thank you and happy World Heart Day. Same to you. Okay, there's a question from Fakri Hamza. Sometimes in sports, people die from heart attacks. That's very true. A few cases already we've read in the papers and all that, but people just suddenly drop and pass away. Can you explain the situation, doctor? How do we overcome this? Is it because of the activity itself that is creating a lot of stress on the heart?
Well, I think the issue of sportsmen or sportswomen suddenly dying from a heart attack during a sports event or activity is probably not a heart attack per se. Most of the time is due to cardiac arrhythmia. Arrhythmia means an abnormal rhythm of your heart. So this sports person or sportswomen, maybe they have a genetic condition known as Hypertrophic Cardiomyopathy. But this is something which will not be detected unless you have gone for some heart screening. And so this is a subset or a group of patients who have a genetic predisposition to abnormal heart rhythm. So basically, during an intense sports activity, they may develop very fast heart rhythm, which is known as ventricular tachycardia. If you know, your normal heart rate is between 60 to 100. When you have this dangerous abnormal rhythms such as ventricular tachycardia or ventricular fibrillation, the heart rate can actually go up all the way to 300 beats per minute. So when this happens, the heart doesn't actually pump normally. It just quivers. It just shakes like that. It doesn't really pump. If it's 60 to 100, your heart pumps normally. So when it just quivers like that, there's no blood being pumped out of the heart. So effectively, it's the same as if your heart stopped. So people have done post-mortem on athletes who suddenly die during a cardiac event. And when they do the post-mortem, they actually detect that the heart muscle is abnormal. And most of them have this condition known as hypertrophic cardiomyopathy. So I think it's a misconception that these sportsmen or sportswomen actually have a heart attack. Most of them, I think, who have this sudden death during sport events is usually due to a cardiac arrhythmia.
So it's not random, doctor, because when we hear about people who just drop and pass away when they're on the field or participating in football and all that, they actually would have some kind of family history.
Yeah, that is yes, that's one group of patients who have family history of or they do have a genetic predisposition to.
Yeah, but how do you find out? Let's say if I were to participate in a certain kind of sports, but I want to make sure first that I don't have this condition. Is there a test that can be done at the hospital for me to find out whether I am, my genes?
Yeah, well, genetic testing is very expensive, but another way would be just to do a simple echocardiogram. So from the echocardiogram, we can determine whether the thickness of the heart muscle is normal or not. There are some patients who have this condition, when they have this condition, actually the wall is much thicker than normal. So it can be picked up from either the ECG or even from the echocardiogram.
Okay, I have another question, doctor. Okay, sometimes the realization that people should lead a healthier lifestyle. So from a sedentary type person to wanting to do a workout, and then suddenly they move like very fast. That means from not doing anything, suddenly the next day they start jogging. I hear that this is not something that is healthy because it might shock the body and so all kinds of things. So would you advise somebody who plans to take up exercises to actually see a doctor first before deciding on their own which type of exercise or how often to exercise? Basically professional advice before you start working out, if you have been sedentary for quite some time.
Well, of course, it's good to see your doctor if you can, just to do simple ECG or stress test. But in general, if you're going to start an exercise program, it's always important to start gradually. Don't suddenly go and play very intense sports, like for instance badminton. That would be very strenuous. Even a normal fit person would find it quite difficult. So you should start with simple things like walking, cycling, and gradually build up your endurance.
Okay, all right. I think that's all the questions that we have for today. If you would like to add anything else, doctor, perhaps an advice for everyone out there who is tuning in. Obviously, they are interested in the topic today. Please, a few words, perhaps.
Yeah, I think my advice is don't take your heart health for granted, because it is something preventable, or something which can be detected early. So always early detection is much better than than actually coming in with an acute heart attack. It's also easier for the doctor to treat actually. So get yourself checked, especially if you're over the age of 30. Or if you have a very strong family history of heart disease, you may even have your health check at an earlier age. Just get a routine medical screening, and then from there, you would be able to determine whether you have any of those modifiable risk factors. And if you do indeed have those modifiable risk factors, then you really have to look into it and really look after and make sure that all those risk factors are well taken care of. So actually, it's always back to prevention.
Yes. Thank you so very much, doctor, for spending time with us today. That was Dr. Dhanan Umadevan, consultant cardiologist from Columbia Asia Hospital, Iskandar, Puteri. With that, we would like to end our session for today. Thank you so much, and we'll see you again on another episode of Doctors Go Live. Bye.
Bye.